Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, over the past 1 year, in fact more than that, we all have come to understand COVID-19 a little, but still there is so much more that is still unknown, like the long-term impact of COVID-19. And now studies emerging say that it's not just that people who had diabetes are more prone to getting severe disease, something that we've practically seen all around us, but worryingly enough, saying that even those who've never had diabetes earlier might develop diabetes as a long-term impact of COVID-19, type 1, mind you. So what exactly is this study telling us? What can we do? Does it apply to India? Does it apply to Indians and Asians, depending on their immunity? All of that is what we're going to decode on the program today. So let's get into our explainer. All right, first up, what is it that we know so far about the link of diabetes with COVID? Where people with diabetes are seen to be at a greater risk of getting a more severe disease of COVID. A study done by a group of doctors involving Indian doctors as well said that they involved about 401 patients with a median age group of about 54 years, and they evaluated some results on them. Of these people, about 189 had pre-existing diabetes and 21 had a new onset hyperglycemia. Overall, about 344 ended up getting a mild bout of COVID, while 51 became extremely severe. The group with diabetes had a higher proportion of severe cases as well. That was about 20% versus 9%. ICU admissions seen higher with people with diabetes as well. Oxygen requirements seen higher with people with diabetes as well. And about 12 out of the 15 which were seen to be most severe, 80% of those who succumbed also had diabetes. Now, apart from diabetes, hypertension was associated with higher proportion of severe cases of mortality, ICU admission, oxygen administration, and all of that. Thus, the study concluded that patients with diabetes or hypertension had more severe disease and greater mortality. So that's what we knew so far, right? But as a long-term impact of COVID, can it even lead to onset of diabetes? Well, various studies have been talking about that, and most seenly in long-term impact as well. This latest research that has come from the Stanford University School of Medicine and at the Cornell Medicine there says that COVID-19 can cause diabetes. How? Well, they believe the virus can infect the pancreatic beta cells. The virus destroys the cells in the pancreas that make insulin. And that's the COVID virus, can decrease the insulin secretion as well, thus effectively leading you to getting type 1 diabetes. Remember, type 1 diabetes not easily reversed with medication, and patients could potentially become dependent on medication for diabetes for a long haul. So that's what it is said to be one of the reasons. But FYI spoke with several other doctors also to bring to you not just this, but 5 reasons why diabetes could be seen as a long-term impact of COVID, especially in Indians. Reason 1, as discussed already, as has been talked about in that study, there is a good possibility that a person who gets COVID-19 may have an attacking directly of the beta cells in the pancreas. Remember, pancreas, the organs on the left side of your abdomen, it works to produce insulin, and it can cause increase in glucose, sugar, and thus diabetes as well. It can also lead to not creating insulin, at times leading to more creation as well. Reason 2, let's talk about that. Well, they said it's not directly related, but indirectly, like an increase in cytokine. That's basically an enormous inflammation response that the virus induces. Remember, we've done a full FYI episode telling you about this and how it can impact your body, especially in kids. Reason number 3 that has been cited by doctors and experts is that problems of your intestinal luminal lining. A luminal lining is basically a single cell layer that form the surface of both your small and large intestine, and they may be a factor of causing diabetes. Also, as we all know, steroids, oxygen, anticoagulation, meaning basically medicines that help to prevent blood clots, They may form a mainstay for treatment in moderate to severe COVID-19 patients. In some cases, we've already seen existing diabetes also, and even those with non-existing diabetes that might be unmasked after the use of steroids like dexamethasone, etc., so commonly used for COVID. And then there is reason number 5. As Asian Indians have a genetic predisposition towards diabetes, and a person with COVID-19 may already have diabetes prior to the infection, just did not know about it. So that's what could be the reasons behind this, but let's talk to experts now who will tell you what to do in a situation like that. All right, let's throw it open to our panel now. We are very delighted to have with us on the program Dr. Amita Gupta. She joins us from the Johns Hopkins India Institute and co-director for the Center for Clinical Global Health Education as well. We have, in some time from now, we'll be joined by Dr. Amrish Mittal. He's a chairman for the Endocrinology and Diabetes Max Healthcare. We have Dr. Subhash with us. He is the founder member and past and present president of the Delhi Diabetic Forum. And we also have with us Dr. A.K. Singh, who's a senior consultant at the GD Hospital and the Diabetes Institute in Kolkata. Let me first go to Dr. Amita Gupta. Dr. Gupta, the latest study saying that type 1 diabetes can actually be a long-term impact of COVID. What more can you tell us about what I've already said? And is it only in US, UK where these studies have been done so far, or do you see the subcontinent, India, as being more vulnerable to this as well?
So thank you very much for that excellent panel and discussion that we're having about diabetes and intersection with COVID. As you rightly mentioned, recently there were 2 studies that were done based on using autopsy tissue, that's tissue from people who've died from severe COVID, to look at whether COVID directly infects specific cells in the pancreas. And why these studies got a lot of attention is because they showed a direct mechanistic link that indeed actually some of the important cells that are in the pancreas, the beta cells which produce the insulin, seem to have receptors that can be directly infected by the COVID virus. These receptors include things that we might have heard about already, the ACE2 receptor, as well as receptors known as TMPRSS2, NRP1, and there are others. And that's thought to be the mechanism where the virus can now actually directly infect the pancreatic beta cells, which are critical to making insulin. So these cells die. The other mechanism that's thought to be directly linked to type 1 diabetes is the fact that some of these cells also get reprogrammed. And so, of course, this is a concern because, as you already mentioned in your background, there are a lot of associations between diabetes and COVID, and this is a new one that's really been more firmly associated. We don't know exactly how many people this impacts directly. That needs to be studied. And of course, as you already mentioned, the Indian and South Asian population has a preponderance and risk, a genetic risk for increased diabetes. So we need to really understand how this will manifest in people who've developed COVID in India.
All right. So interesting fact there on how it can actually alter and it can lead to further complications as well. We have with us Dr. Amrish Mittal also joining us. The study that I quoted earlier on in the explainer was actually done under his leadership at the Max Hospital here in the national capital. Then Dr. Mittal, then just wanting to reflect more on the study which says that it can actually lead to more type 1 diabetes cases. Now, we already know that India and the subcontinent is very genetically, we are known to be prone to, but we've been known to be prone to type 2 diabetes. Type 1 is what this study now talks about. How are you seeing this play out with the Indian gene pool?
So, thank you, Sonal. Yes, I mean, we're actually looking at 2 somewhat parallel things. One is aggravation of type 2 diabetes or unmasking of type 2 diabetes, if you will, in those who are pre-diabetic or almost there already, or maybe some who were okay, but the combination of COVID and the stress and the steroids did it to them. But we are also looking at direct impact, and the study that Professor has quoted is about the direct impact of the virus on the beta cell. So that kind of diabetes is not necessarily commoner in India or different in India. That's the type 1 diabetes that happens. If you're talking of pure typical type 1 diabetes, that's the same worldwide. In fact, some people think it's a little less common in India, but we don't know that actually. So the thing is that this opens up a new area. What intrigues me about this is that we will have to link the occurrence of type 1 diabetes, clinical occurrence, with a prior COVID infection. How soon after COVID, whatever we know that type 1 diabetes does tend to occur after several viral infections in the past. But COVID, if it's directly damaging the beta cell, is a different story. In one line, the thing that really interests me in addition to this is, does it make a difference to type 2 diabetes in the sense that if you have type 2 diabetes, there is some degree of beta cell dysfunction. And maybe if it's not a complete damage enough to produce type 1, maybe people who are sort of borderline or pre-type 2 diabetes, this kind of virus-induced damage to the pancreas, can it trigger off a typical type 2 diabetes? But I am just speculating there. I have no evidence, but it's interesting, very interesting research.
Right. And before I go to Dr. Subhash, and I know we've got Dr. Singh also waiting, I just want to go back very quickly to Dr. Gupta. Dr. Gupta, in this study, could you shed more light on which kind of people, age group, gender, are more likely to develop type 1 diabetes? Is that clear from the study, or is that something we have to wait for?
Yeah, so great question. I think we don't have that answer fully answered yet. Usually type 1 diabetes, as we understand it, is that it's a disease that occurs earlier in life and results in needing insulin, it starts in childhood or even in adolescence, and much less likely in adulthood. Whereas the type 1 diabetes that we're seeing now appears to be developing in adulthood. And so that's what also distinguishes this from some of the typical features of type 1 diabetes. But we need more information.
We need more sort of coming out of this study. Let me bring in Dr. Subhash at this point. Dr. Subhash, then generally the question that comes to mind is, what are the symptoms that one should be watching out for? Since Dr. Amrish Mittal also pointed out that it's not just type 1 diabetes in India. We've seen sort of unmasking of type 2 also happen post-COVID. So what are the symptoms do you think people should be watching out for? And especially I know people who've had a genetic history or a family history of diabetes are watching this show with a lot of nervousness. So what can you tell them to put them at ease, or some tests, etc., that they can do to try and detect it at an earlier stage?
Yeah, I fully agree with Dr. Amrish that we hardly see any patients post-COVID or during COVID developing a typical autoimmune type 1 diabetes, because of whatever the patients we have seen, this is primarily a worsening of the existing pre-diabetes, or there's a new onset, what we call the hyperglycemia.
Right.
I'll go back in symptoms. Some of the patients who get COVID, they are not aware whether they are having diabetes in the past or not. So the moment patient lands up in the emergency with the COVID, we do at least 2 tests. One is the HbA1c and one is the fasting plasma blood sugar. What we have seen is the HbA1c is more than 5.7, but below 6.5. So we tell the patient might be having already a condition called pre-diabetes, which gets worsened with the COVID infection. And the moment the HbA1c is more than 6.5, it is very clear that the patient was having pre-existing diabetes, which got detected by the infection of the COVID. And the usual symptom, apart from the COVID infection, that they come with because of hyperglycemia, increased thirst, they drink a lot of water, and they get recurrent infections because of the COVID and because of the hyperglycemia. So this is important to tell every patient who comes, do a fasting blood sugar, do a HbA1c. And even what we have seen, mildly elevated fasting blood sugar was a norm in all the COVID patients, what we have seen, though they may not be in the range of the type 2 diabetes, but the mildly elevated fasting in the pre-diabetic range was very commonly seen in the patient who got admitted with a COVID infection. To look out, not only at the symptom, but do a HbA1c and the fasting blood sugar, each and every patient right at the time of admission.
Right. So HbA1c, one of the tests that you can look out for. Apart from that, correct me if I'm wrong, and if I can bring in Dr. Singh at this point, that generally if you are feeling more thirsty, if you are running to the loo too often, you're feeling if there is a sudden weight loss or weight gain, that is also something, these are the symptoms one should be watching out for post-COVID?
Well, thank you, Sonal, for having me in this show. All previous panelists has discussed in length about this new NTT, which we call as a new onset diabetes. Just to answer your question, this new onset diabetes will have a similar symptoms what a typical diabetic patient presents with. So it's not different from the diabetes which we see every day. The point remains is we are still in a very early stage to really conclude that COVID itself causes diabetes. As Dr. Amita said, we had 2 papers simultaneously published last month in Cell Metabolism, one from Stanford and one from New York, while one study claimed that COVID can directly damage beta cell and can cause a permanent, type 1 kind of diabetes. The another paper claimed that it just causes, a differentiation of cells in pancreas. Means it is temporary and it could be reversed. So there are 2, diagonally opposite thought with regards to COVID-associated diabetes, and there are international, COVID registry where we all are putting our new onset diabetes into that.
Right.
So
we discussed
what I would
that
like
to explain. I'm just intervening here because I want to understand. Then, are you seeing this? I'm just trying to understand the age bracket here. Are you seeing this happen more with younger people now, with older people, somebody who's had history of diabetes in the country? I'm just trying to understand sort of a bracket of people who are seeing more and more of these symptoms, both type 1 and type 2, as you said.
Well, so if it is directly COVID related or COVID associated diabetes, it has nothing to do with the age. So anyone who had developed COVID-19, and if at all COVID-19 has got a fascination or tropism, what we call in medical parlance, to the pancreatic beta cell where from the insulin is secreted, then it has nothing to do with the age. It can happen to anyone who had developed COVID-19.
All right, that's a little worrying over there, but let's slip into a short break at this point. When we come back, we'll try and talk to our doctors about, so what is it that you can do to prevent yourself from this? That's coming up on the other side. Welcome back. We're discussing COVID and the relationship it has with diabetes. And let's go back to our panel now. Dr. Mittal, just want to understand from you, if this is the case, and we're seeing more and more studies talk about that now, what can be done?
I think about type 1 diabetes, which is still an enigma, it's a very interesting finding, but if at all it happens and it really is evident in terms of numbers, that will be a big story there. But at the moment, we haven't seen too much of that, but single experiences will not count in such a disease which is not common. You need to get data from across. But the regular type 2 diabetes, which is clearly being unmasked, means that most of the people who are actually now, either they were diabetic beforehand. In our study, as you showed, 38% people were already diabetic. They were known diabetics. 9% didn't know they were diabetic, but as Dr. Vamnu pointed out, they were found to have high HbA1cs on admission. And another 5-6% both these were normal, but they developed high blood glucose during hospitalization, and that happened again, as I said, because of infection, virus, stress, steroids, everything
Sometimes
combined.
treatment also,
now, most of these will go back.
Okay.
The ones that newly developed diabetes we expect will go back. New onset hyperglycemia clearly, typically reverses after 5-6 weeks. Okay. So in a maximum 5-6 weeks. So basically what I'm saying is that we have to be careful. We have to make sure that after this, firstly during COVID, as pointed out, we have to check our sugars and ideally HbA1c. But also after that, when we've recovered, it's good to check your sugars properly at least a few times, even after recovery from COVID. I think that is the key point. And if you are a diabetic and if you had high sugars, it's very important to maintain good glucose control in the post-COVID period also, because then you're reducing your risk for other things like mucormycosis and long COVID, etc.
Sure. All right. Let me bring in Dr. Gupta as well. Last few minutes on the program. You know, we've seen what is now called COVID long haulers. People who've had extremely, you know, fatigue or body ache or foggy head or foggy brain as it's been called. And that just goes on for months at times. We've seen that happen with young people. We've seen that happen with very fit people as well. So to them, what is your tip on to ensure, if there is any really? I just want to find out if that's something they can do to keep fit, something they can do to ensure that it doesn't stay in for longer.
Yeah, so this is a great question. We don't fully know what to do to fully prevent other than to vaccinate so that you don't get COVID at all. I mean, that's sort of clearly a clear way to prevent it. What we do know, though, is to continue to be engaged with your health care, to be followed carefully, to eat well, sleep well, you know, exercise to the extent that you can, so that you can prevent, you know, like we would with any other illness, long-term sequelae, whether it be diabetes, whether it be lung disease, kidney disease, etc. It's important to be following up with a doctor, a healthcare provider. So, you know, we're learning a lot about how long does long COVID exist, what are the exact manifestations. We know, as you mentioned, it can impact the brain, the kidneys, now we know a little bit about the pancreas, but we don't know how often, how long, who, what are the typical risk factors and long-term sequelae, because we just haven't had this disease long enough to know. In India, we've had
the heart being impacted as well, and that's something that has also been seen. Thank you all. That's all the time we have on the program today on this very fascinating discussion. We'll continue to keep a track on this story. That's it on FYI today. Bye-bye.